1980s. Just that right there. Um, should I be surprised? Should I be surprised or not surprised? Are you surprised that the only way, when we hear that vaccines are safe and effective, even before COVID, when we hear that vaccines are safe and effective, that children do great with it, we're all under the impression that these reports we're seeing, 400 deaths every single year in the United States of America from this very system, that, at least the system's being used and you were unaware of it. Do you think that that would, if I was to sort of pull most of the doctors and nurses in your hospital prior to COVID, would they have been aware of VAERS?
No.
No.
Unless maybe if they were pediatricians, they would be aware of VAERS, because you would see that in the pediatric population.
Right.
But for adult providers, unless it's a pediatric hospital or pediatric clinic or a family medicine clinic where you see kids, no, that isn't. And even there, nobody knows about VAERS.
And if you
it's really, I shouldn't say nobody. Very few providers know about VAERS.
Okay, but I think even we also have to be honest that your pediatrician is not where you're going if your child's having seizures. You're going to the ER. You're going to a regular hospital. You're not going to your pediatrician's office.
Correct.
So if they're the only ones that know about it, we're going to have a problem here. All right, I don't want to dwell in the past. Let's get to where we're at. I'm just sort of trying to understand the culture of what we're talking about. When you finally, how did you find out about VAERS?
I went online and started looking up about these vaccines, and VAERS was part of looking up the vaccines. I started seeing, websites about VAERS, and I'm like, oh, what's this VAERS? I'm going to go on it. And then I started reading about it. And then I saw the clip that said, healthcare workers are required to report to VAERS by law. And that really hit me hard, because I'm like, I'm a healthcare worker and I'm required by law. Whoa, I haven't been doing this. And that really concerned me. Mm-hmm. And I said, my colleagues haven't been doing this. What does this mean?
And so then you start doing these reports. And now I want to be clear, because the language, a lot of people, there's conversation, I know that you've had them in your hospital of, is it over-reporting? Is it under-reporting? How do you know it's a vaccine injury? But to be clear, the language is very clear on VAERS. It tells you it is not your job to determine whether this is induced by the vaccine, but simply if it happens within this timeline, you submit it and we will do the work to, pull it out or put it in, correct?
Correct. Correct.
Okay. And so I also want to ask you another question, because this is huge. And this is an argument, frankly, that's in just, in the civilian population now, which is when you say, well, you do realize there's like 14,000 reports of deaths now in America. And I'm shocked to find your average, person now is saying things like, well, VAERS is unreliable because it's just reported by anybody. It can be anybody at home reporting to it. They don't really do anything to verify it, and so it's unreliable. And what would you say from your perspective? Is it unreliable? Is it just something that it just gets thrown up there and there's no due diligence to make sure it's a good report?
No, it is a full-time job. Reporting to VAERS is a very involved process. And I give kudos to the VAERS people, the individuals who work for them, because they really do try to get the information. But because of that, it really is a very involved process. And I completely disagree that anybody can report to VAERS. But I believe there's very few patients who themselves report, because they require so much data that a patient wouldn't know.
Okay, like
and
what?
So they ask questions about blood work, about your individual story, like what exactly happened to you. Did you recover? The dates of the vaccine, the lot number of the vaccines, your allergies, your medications, if you've been in the hospital previously, if you've had a reaction, all kinds of questions. And I would think most patients would go to their provider to ask them to report, because it even asks who is the best medical provider to contact about this case.
Yeah.
After reporting, many times I get constant calls and emails from VAERS every week wanting to discuss these patients.
So they actually follow up. They
Oh,
don't just
very
go, it
much
doesn't just
so.
go into it like we just throw it right up on
Oh,
the board.
no.
They call about each case, ask you details that
Yes.
may not have been filled in, or for more information.
Yep. After you submit the report, you get an immediate E number, which is basically a temporary number. Then VAERS kind of looks further into the case.
Okay.
And many times they request medical records, or they call the provider and they want to discuss the case, and you discuss it with a physician or a PA.